everyone, and thank you for joining us for this event hosted by the Multiple Sclerosis Foundation, also known as MS Focus. I'm Casey Minnis, Executive Director of MS Focus, and today I'm delighted to be joined by Cherie Binns. Many of you may know Cherie as the administrator of our forums. She's been working with the foundation for many years, presenting for us, writing for us, and this year, we're so pleased that she's joined us as our patient healthcare liaison. With her experience as a certified MS nurse and as a person with MS, she's uniquely qualified to translate healthcare material for the patient audience. We're so excited that today she'll be talking to us about how to manage symptoms. And so, Cherie, I will turn it over to you.
Thanks, Casey. Today, I wanted to share with you some ways that we can manage our MS symptoms without necessarily involving our healthcare team. And for the most part, I'm going to be telling you ways that I have personally found to minimize some of those symptoms that can be debilitating or get in the way of comfortable living. Because I have never used cannabis products for my MS symptoms, we will not be talking about how they can be used to relieve symptoms. So today is just sort of a wisdom sharing. I share with you how in the nearly 30 years that I have known that I've had MS, how I have dealt with some of those symptoms and side effects. So first of all, we're going to talk about pain. Back when I was diagnosed with MS, we were told that pain was not part of MS at all, that pain was probably a psychological response to the chronic illness, the fatigue, a lot of the other ramifications of MS. But we now know that more than half of us that have MS suffer from pain. And there are two basic kinds of pain, and they're dealt with differently. One of them is nerve pain, which can happen because of lesion placement. We might have a nerve that is misfiring because some of the myelin has been damaged around that nerve. That's treated very differently from musculoskeletal pain, which is probably even more common because as a side effect of spasticity or maybe a gait interruption. So really with dealing with that musculoskeletal pain, you want to be working those muscles. You want to be stretching on a regular basis. Spasticity or gait problems can really cause tension in the muscles, particularly of the hip and lower back. You may also find that in your legs. I never knew I had spasticity until probably 5 years into a real difficult, painful sleep cycle. I thought that I'd had an injury from a car accident, and it was waking me at night with hip pain, and I felt like I was on a spit. I was turning every 20 to 30 minutes all night long, sometimes more often, just to get into a comfortable position. But what I discovered once I saw a physical therapist was that pain that I was having, which manifested as a bursitis in my hip or an inflammation around the hip joint, was actually related to spasticity in my leg. It was related to the muscles being too tight. So exercise, stretching is extremely important to help manage spasticity and muscle pain. Your physical therapist can really tailor a program to you, what works for you, what you feel comfortable doing, what your body needs to work on those problem areas. I used to hear exercise and think, I don't want to do exercise. As a kid, I always hated gym class. I never liked working out in the gym. I never got to a point where exercise felt good to me until I started working with a physical therapist. And listening to my body and listening to what they told me. So yeah, in that sense, I'm asking you to reach out to a medical professional and get some guidance so that it can be tailored to your personal needs. Heat and ice might also be helpful for pain, whether it's nerve pain or whether it's muscle pain. You just have to be aware that with heat, to relax those muscles when we're in the midst of a heat wave like we are right now, it might be counterproductive. Things like TENS units, which are a little electrical stimulation through a pad placed over an area of the muscle or an area of pain. These are relatively inexpensive. Back when I started using them, the machines were costing $400 or $500 a piece. You can now get them at a surgical supply center or a drugstore or Amazon even for $30 or under. And I find that extremely helpful, particularly if I can't seem to really get a handle on a muscle that's really tight. If you've got nerve pain, I have a patch on the side of my leg that fires whenever something rubs against it, or the wind blows against it, or I accidentally touch it or reach down to scratch it. It just about sends me through the ceiling. And something like a lidocaine patch or EMLA cream, which some of you may have used for injection site reactions, can sometimes alleviate some of those point nerve pain items. And then many people have found acupuncture, chiropractic massage very helpful for managing that pain. I had a massage session about maybe a week and a half ago that just worked wonders. I had been doing everything I knew to kind of work on a hip low back pain, and wasn't able to work on it. And my massage therapist really addressed that very nicely, and I haven't had a resumption of that. So you might want to consider some of those alternative practitioners. I think probably the biggest thing that I've found that impacts pain is sugar. Some of you may have heard me talk before and know that I think it was 2007, I cut all sugar that was added to food out of my diet. No sugar in my coffee or tea, no desserts or pastries. Sugar that occurs naturally in fruits and vegetables is fine. That's not a problem. But what I found, if I've gone for a long period of time pain-free, which I actually have gotten there and I never thought I would get there. If I cheat and I have a cookie, a bite of a cookie doesn't do it, but a whole cookie will. I realized the next day that I've got low-grade pain. Now, sugar for me, and I think for most of us, is very highly addictive, and one cookie often doesn't do the job. So I'm drawn back to it, and the more I eat, the worse the pain is. So I just want to give you a heads up that if you've got some of those sugars in your diet and you are in pain, that's one very easy way that you can work at getting rid of it. But I have to tell you from experience, you may have to be off of sugar totally for 3 or 4 weeks before it completely kicks in and knocks down that pain level. I mentioned spasticity. Probably half of us, at least with MS, experience spasticity at one point or another, and some of us for most of our life with MS. Spasticity can be treated long-term with drugs, but as I mentioned before, you really need a maintenance plan to keep those muscles worked and out of spasm, and that includes a regular stretching routine. So again, your physical therapist is the perfect person to work with you on that, and it may have to be changed throughout the course of your life. one exercise that's given to you this week may not work in 6 months, and you may need to tweak it in one way or another. Or I have found sometimes that as I'm doing an exercise, I'm not paying as much attention maybe to the way that my body feels as I'm doing it, as I'm doing a stretch. And the next time I see a physical therapist, they'll ask me to demonstrate the way I do it, and I find that I'm not doing it completely straight. If I'm bending a knee out, rather than straight up and down, I might be sort of angling it instead of straight up and down, and that can make a huge difference. So if you find that pain is increasing as you're doing your stretching or exercise, call up your physical therapist and ask if they can put some eyes on and see what you might be doing that might need some tweaking, or if there's something else that they need to add to it. There really is a role for tailored exercise, for personal medicine, for management of pain and spasticity or gait issues. You may not even realize you've got a problem with your gait until somebody else sees you walking with eyes that aren't feeling what you're feeling. I know that foot drop has been a problem for me for many, many years. And I often will get to a point where I feel like I've got everything under control and I'm just trucking along and walking and my toe catches. So over time, I start walking a little bit more carefully, hiking my hip a little bit to keep my toe from catching. And that causes the low back pain to kick in again. So there is a cycle of things that can be set up. And where pain and spasticity are the root of your problems, a physical therapist is probably a really good person to have on your healthcare team that you can call and work with. You might even be able to do a telehealth visit and show them what you're talking about. Just be sure to set your camera far enough away from where you are that they can see you walk, that they can see you move, if that's the case. And also, again, acupuncture, acupressure, and chiropractic may be helpful for you with some of those problems. Fatigue is a really big one. More than 90% of us have complained of fatigue that can be crushing at times. I kind of use fatigue as a barometer to say when I might have an infection or when I might be relapsing. If that's the case, I don't have normal urinary tract symptom or urinary tract infection symptoms when I get a UTI. And what I find triggers me to really look at whether or not there might be something going on that needs treatment is I feel like the starch has gone out of my spine. It's hard to sit up. It's hard to really take a deep breath. I tell my husband it's knuckle dragging fatigue because it's just so hard to stay erect. And for me personally, that's an indicator that I have a urinary tract infection. And with treatment, that goes right away. I haven't found a lot of medications that work to really manage my fatigue. They either make me too hyper so that I can't sleep well at night, and that adds to the fatigue. It starts this vicious cycle. Or I find that they just don't work at all. And I know many of you are using things like Provigil or amantadine for your fatigue. I would really recommend that you not take those every day. You can build up a tolerance to them so they stop working for you. They can raise your blood pressure. They can interfere with sleep patterns. So when I was using them to keep in the workforce so that I was still working a 40-hour week, I only took them on days that I know I had a very busy schedule, or days when the heat index was so high because my job had me in and out of patients' homes as a home care case manager. And so when there was extreme heat, or when I had a lot of patients on my caseload for the day and couldn't be in an air-conditioned office for part of the day, I would take a medication to help me with my fatigue, but not when I wasn't working, unless it was a special occasion where I had to go out to an event, or even to get out of the house for church or something like that. I might do that. It's really not appropriate to take if you're not working, if you're at home all day long, unless you have some really difficult tasks that have to be completed, if it's a day that the house needs to be cleaned. But I would say do your best to divvy up those jobs so that you're not doing a day long of housework and really wiping yourself out, so that you have to take a couple of days to recover from that. Again, sugar is huge in fatigue. I can't stress that enough. But one other thing that I found for me personally that helps as far as a dietary change, when I eliminated most dairy and all gluten from my diet, my fatigue lifted. I wasn't getting as much fatigue issue as what I had before. And again, like with the cookie, if I add in the dairy or the gluten for 2 or 3 days, if I'm traveling or going to a conference or something and I'm not cooking myself, if I'm just having to eat what happens to be available for me, there's often high gluten or dairy content in a lot of the foods that are presented. And so I notice that the fatigue level is much higher when I eat those things. Most of us have some vision problem at some point during the course of our MS. About 90% of people, the initial symptom that takes them to the doctor is visual, often optic neuritis, which is an inflammation of the optic nerve. For me, that was the symptom that finally got me to a doctor after many years, something that I could say, you know, this has happened before, and it's happening again, and I'm missing a portion of the vision in my left eye. The eye doctor said my eye looked just fine. But when I drew out the sort of cloud in the center of my vision, he did visual field testing, and that visual field testing showed exactly what I was drawing out for him. And he tells me, the eye doctor tells me that they are one of the first lines that send people to a neurologist for the MS diagnosis. So he actually ordered my initial MRI and made an appointment with me or for me at an MS center near where I lived. And I had a diagnosis 5 days after that visit with my eye doctor. But again, that for me, that was 19 years into my symptom clusters. And that was back at a time before disease-modifying therapies were generally available to us. So my journey is very different than many who may be listening today, because you've caught it early. You're hopping right on things before there's a lot of damage done. And so you're doing really well. But with visual symptoms, I just want to say that steroids are not always necessary. In fact, they shouldn't necessarily always be given. There have been several studies that have been done over the last 25, 30 years of looking at people who have optic neuritis that are treated with IV steroids or now with high-dose oral steroids, and those who were not. Those who got the steroids may have recovered a little bit more quickly than those who didn't get the steroids, but 10 years out, there was virtually no difference in usable vision. The difference was that in the steroid-treated group, people were heavier, they were developing bone loss, they were developing diabetes, they had high blood pressure. There are so many things that steroids do to us metabolically over time that we want to avoid if we can. So steroids should not be used to help us feel better or to get over an optic neuritis quickly. If there is total blindness, yes. But if you've still got a usable vision, even if it's hazy, then, you know, have that conversation with your doctor. Talk about the pros and cons of steroids. Really try not to demand them. Listen to the wisdom of your doctor. Most of our doctors will give us steroids if we ask for them because they respect what our bodies are feeling like. But I will tell you that 2 years after I stopped taking steroids, I started breaking teeth. I started breaking bones. In a 3-year period after that, I lost 5 teeth or broke them and had to have them crowned or root canaled. I had more than 70 different fractures, mostly hands and feet, but also a couple of spinal compression fractures because of all of the steroids that I had had in the 2 years prior to that. So just a caution. The other thing is, if you're working working at getting over an optic neuritis, you want to rest your eyes. Stay off of your cell phones, stay off of your tablets, stay off of your computers. Reading is okay, and so is watching television, but you really want to rest your eyes as much as possible. Get outside if you can and enjoy nature. Enjoy the textures that you see or feel in your environment, and really take some time to just slow down, kick back. I think things will resolve for you a little bit more quickly if you do that. Bladder symptoms are another thing that plagued me when I was younger, to the point where I was not able to empty my bladder fully for probably 10 years and needed to do intermittent self-catheterization. I was scared to have to do that. I was not at all comfortable with the idea, even though I had taught patients to do that before. But I'll tell you, I think one of my patients actually helped me get over that fear before I ever had to start doing it for myself. I was supposed to show up at her house. She was a woman who had MS, and she was starting intermittent self-catheterization. This was back in the days when the catheters that we were using were like this long and not the little ones that we currently have. I went to her house to teach her, and I got there and she said, "You don't have to worry." They arrived and I pulled one out and I looked at it and I thought, well, there's 3 holes down there, and I know it's not that one, and I know it's not that one, so let's try this one. And she said, "I got it, first try." And it really is that easy once you get the hang of it. So there's a couple of things, though, that I found very helpful, particularly with my history of urinary tract infections. You want to stay well hydrated. And I know if you're leaking, if you've got some incontinence, you may be a little hesitant to drink much. And so you sip throughout the day to relieve dry mouth. I have a saying: you sip, you drip. You want to drink an entire glass of water in one sitting. Oh, all right. So it's hard to see the glass. You want to drink an entire glass of water in one sitting, because what that does is it goes into your system and it filters through your kidney and into your bladder within 20 to 30 minutes. So once you've had that glass of water, you can empty out. If you're just sipping throughout the day, you tend to have that sense of urgency, need to go, and then you're only voiding just a couple of tablespoons at a time. The average bladder, the average healthy bladder should tell you it needs to empty when you've got approximately a cup of urine in your bladder. So drink that cup of water, wait for half an hour, and let it empty out. You might say, well, if I drank that whole cup of water within 5 minutes, I would know I needed to go to the bathroom. So wait 7. And once you get into the bathroom, see if you can sit on the toilet and still wait another 2 or 3. And in doing so, you actually teach your bladder to hold more. You teach it to stretch. You gradually increase the capacity of your bladder so that it's able to hold more and give you more time between bathroom breaks. There are bowel and bladder therapists out there who also work with people for sexual dysfunction as well. And most spinal cord injury centers have a bowel and bladder therapist on staff, or at least one in the area. So if you have a center that treats spinal cord injuries or an MS center near you, and you have issues with bowel, bladder, or sexual dysfunction, see if they don't have a bowel and bladder therapist on site that can help you. Citrus and caffeine are both bladder irritants. Citrus actually, orange juice, grapefruit juice, can actually erode a protective lining that's in your bladder if you're drinking a lot of it, more than just your little 6-ounce glass of orange juice in the morning. But if you're sitting and drinking a whole glass of juice, a water glass full of juice, or more than one throughout the day, that can erode that lining. Any caffeine-containing beverage is a bladder stimulant. So it may make you feel like you need to go more often than you actually do, because it's kind of, I like to say, it sort of gives a prickly feeling to the bladder, almost like it needs to empty. But when, in fact, when I actually try to empty my bladder, it's far less than what I would have thought from the sensation if I've had 2 or 3 cups of coffee over the course of an hour. So just be aware, if you're having an irritable bladder, that it could be the citrus that you've got, that you're taking in, or it could be caffeine containing beverages. And those caffeine containing beverages also include colas. So if you're having sodas that have caffeine in them, Mountain Dew is one of the highest caffeine concentrations of any beverage, way higher than coffee or tea. So if you're drinking any of those things, you might want to take a look at what you're drinking, maybe add an extra glass of water for something that you're taking away that is a bladder irritant. I know a lot of us are experiencing some cognitive decline. For me, that's kind of what took me out of the workforce. By the end of a work day, I felt like I was just not cognitively intact. I couldn't think straight. I had trouble finding words. I was very easily distracted, so that I often didn't finish a train of thought. If somebody else interrupted the conversation or the phone rang, I would lose my train of thought. The thing that actually saved me in my job was doing neuropsychological testing. There are many tests that your doctor may do at least an annual MS clinic visit that kind of give an overview of your cognitive status. And unless there's something really glaring, those simple tests that they do in the office don't really pick up major problems that could be underlying that might be correctable. A real lifesaver for me that came out of that neuropsychological testing was I was referred to a cognitive rehab therapist. These are people that are either psychologists with a focus on neurology, or they could be speech therapists or occupational therapists. And what this therapist did with me was she basically asked me what my job was like. What were the physical and mental tasks associated with my job, and then went about giving me tips to sort of streamline, to minimize or eliminate distractions, to remind myself so that I didn't lose track of time. Now, this was before we had cell phones that we had alarm clocks on. And now that I've got a cell phone that reminds me what I need to do, it's ever so much easier than Post-its everywhere or setting alarm clocks or things like that. We just have so many tools right now, which can be very helpful for that. I've heard from many people that cognitive retraining involves playing games. It really doesn't. You've got these Lumosity programs out there. They have been shown minimally to be helpful for people with age-related dementias. It helps to keep them a little bit sharper. But for those of us who are in our younger or middle years, they're really not that helpful at all. And they distract us from things that we should perhaps be doing or giving greater priority to. We can kind of get hooked on some of those games, which keeps us in a place where we're not interacting with other people or being as productive. So the games are not really all that helpful with MS cognition problems. And about half of us are really kind of dealing with one level or another of cognitive problems that need to be looked at. Sleep is an issue with cognition. Excuse me. Yes, I did sip, but my throat was getting dry. Sleep is one of the things that we have some control over with MS cognition slippage. It's often very easy to get involved in a show or in playing computer games or in social media or in a really good book and not be turning off at a regular time every night. Even a half hour of lost sleep at night sets us back during the next day cognitively or fatigue-wise or pain-wise. It can add to stress. It can dampen our mood. And so I would recommend that you go on our Facebook page and read the article that got put up by Dan Digman yesterday on 7 ways for a better night's sleep. Dan really has laid out some very simple tools to focus on to give you the best night's sleep possible. And I think sometimes we might need to at least let our doctors know what's going on. Alcohol before bed for many people actually worsens a night's sleep. You probably want to, if you like a glass of wine or beer or something like that with dinner, make that your last drink of the day. There are some people who can have a drink before bedtime and not have it impact their sleep negatively, or in rare individuals that may even give them a leg up on getting to sleep. And once they're asleep, they can stay asleep. But what happens is if you're drinking right before bed, the alcohol is kind of out of your system in about 4 hours, and that will wake you up. And so you may get less of a night's sleep than you would if you had it several hours before you went to bed. Exercise in the morning usually is a better option if you have sleep problems. For most people, at least, that's the recommendation I've always gotten. For me, however, I find that if I exercise in the evening before bed, I sleep better than if I do in the morning. What happens in the morning is sometimes my exercise routine will add enough fatigue that I'm not as productive as I want to be during the day. And so I'll exercise in the evening after the TV's gone off, and then I'm ready to shower and climb into bed. So know your body, learn what works for you, and use that as a routine. Mood issues can also come out of a lot of the things that we've been talking about. If you're in pain chronically, your mood is not going to be good. Chronic pain interferes with sleep. It dampens mood. Even the most sunny dispositioned person can become a grouch with chronic pain. And people who have MS, and I think this is partly lesion load. I think it's partly the fact that we're grieving. We're grieving a life that we wanted to live and don't see the option for doing that anymore until we get through that place and find out that life can be very fulfilling, very enriching. That's a normal process. I think all of us go through a deep period of grief after diagnosis, even if the diagnosis is a relief to us. And so allow yourself to grieve. But if that grief gets to be so deep that it's impacting your relationships, you do need to seek help with a mental health counselor. As of this past Saturday, we have a new 3-digit mental health hotline number. You no longer have to call the 10-digit number for the Samaritans or the suicide hotline. Any mental health issue, you can now dial 988. And the same people that used to answer the calls for the 10-digit number are going to pick up that 988 number. It's not fully actualized throughout the entire US yet, and they're working on it, but probably about half of the US is covered by that now. The 10-digit number will be able to get you through without the 988 at this point. But I find that with mood, a change of scenery often helps. You know, when I get the most down is when I don't have a project going on, when I don't have something that's mentally stimulating, when I maybe sit at the computer for a couple of hours doing games. My mood just darkens. I get irritable. And so a change of scenery is very helpful. Try not to, try to limit your screen time to maybe a half an hour at a time, except of course for something like this, when you're going to sit and be a captive audience for several minutes. Music can sometimes help. But there are certain musics or certain beats that I find can be irritating when I'm in that mood. So listen to your body. Sometimes I just need silence. Listen to what your body is telling you. But if these periods of darkened mood last for more than 2 weeks at a time, you need to share that with your doctor. You need to get some help for that. I'm not saying you need to go on to an antidepressant. Most of our dark moods, most of the anxiety that we're living with, can be very easily treated with some tips that you can utilize at home, to breathing techniques, visualization, meditation. Those things are all relatively easy to learn and cost nothing to put into place in your home. I see we're about 40 minutes in, and I have one person in the Q&A. My husband and I play cards, which I feel is good because it involves strategy, and we do talk during the game as well. I think this helps my cognitive ability. Absolutely, Sharon. I totally agree with you. We are also a game-playing couple. We play backgammon at breakfast, and if we have lunch together, it's usually progressive rummy or Scotch bridge. And then at supper time, we either play triominoes or dominoes or Yahtzee. So yes, those things are all good. They help us to develop problem-solving skills. They help our brain to stay active. So I am at a point now where I'm happy to take your questions, your input, but again, I will say that this talk is about things that I personally have found work for MS symptom relief. So questions about CBD oil or cannabis products or things like that. I'm really not the expert on that. I would say that if you can dial into one of Dr. Thrower's monthly conversations, that he is a far better person to answer your questions on those types of things. If you have questions about medications that might be necessary, then I can certainly steer you in the right direction for that as well. Any experience coping with vertigo? Yeah, I've had several periods of vertigo over the last 30 years that have really disrupted things. One of those was related to a sinus infection and one to an ear infection, and I didn't even have an earache. So I would say vertigo is something that you should probably check out with your doctor. I've seen postings on our Facebook page of some people that have had a program that they have been given to readjust the crystals in their inner ear, and it involves postural changes. I really don't know much about that, but I would say that very, very often an audiologist could help you with that. Maybe even a physical or occupational therapist. But again, vertigo is something that you should bring to the attention of your doctor. Most of the medications that they give us to handle vertigo are of an antihistamine category, so they can be very drying. They can be fatigue inducing or make you drowsy during the daytime. I certainly don't want you driving if you're having vertigo problems. Let's see, Sharon. What about water drinking? I heard it's not good to drink water from a straw. Have you heard that? And why is it better to drink from a cup? Drinking water from a straw actually can cause you to be swallowing more air, which can cause bloating, which can cause gas, which can induce hiccups, which can cause a feeling of fullness. If you're drinking through a straw, there are certain dental reasons why you might not want to drink through a straw. It concentrates, for example, if you're drinking coffee, it can concentrate, iced coffee, iced tea concentrates the tannins that can stain your teeth on the teeth themselves, rather than them just going over the teeth and past the gums. Watch out, stomach, here it comes. So yeah, water. I've heard several recommendations for water, minimum of 8 glasses of water a day on average. The other thing that often is said is if you take your weight and divide it by 2, that's how many ounces of water you need to get in a day, or not necessarily water, but fluid. And you want water to be the majority of that fluid. No more than 1 or 2 sugared drinks like a juice or a soda per day. They really can mess with your MS symptoms. I don't see. Do we have any other questions that I can answer? If you want to ask a question, raise your hand and we'll ask you to unmute and you can ask your question.
Add that there are a couple of ways that people can ask their questions. You can use the Q&A button at the bottom of your screen to type in your question, which will allow you to do that anonymously if you choose. You can type it in the chat if that's easier for you, or as Cherie said, you can hit the raise hand button if you'd like to ask your question live.
We got a couple more in the Q&A. Do you have some advice about foot drop? Happened to me suddenly walking on the street. I have few bad falls. Sorry for English. Hope you understood. I totally understand. Foot drop was one of my earlier symptoms and stayed with me for a very long time. Again, a physical therapist is going to give you some helpful hints on foot drop. In more severe cases, you may need to use something called an AFO. That's an ankle foot orthotic, and it's just a little brace that fits inside your shoe that keeps that toe from dropping down and catching on the carpet or on a stair or on the sidewalk. I found something many years ago that worked for my relatively mild foot drop, and it was called Foot Flexor, FOOT hyphen FLEXR. If you type that into your search bar when you're online, it will take you to a website that sells them. These are an item that was designed to help give people who were sprinters and runners greater force in their push off as they were running. And what it is the cuff that Velcros around your ankle. And then there's a 1-inch heavy twill tab that hooks into a little lock tie or zip tie that you put on your on the grommets at the front of your foot on your sneakers or your shoes, and that slips through there and you tighten it up to keep your foot from flopping down. I found it gave me a far greater stability. They were about, I think, $30 for a pair. They're not covered by insurance, but it's certainly a lot less costly and time consuming if something that simple works for you. But again, I think I would start out with a visit with the physical therapist, have them evaluate your gait, mention the foot flexor to them, but it's not FLEXOR, it's FLEXR, and it's foot hyphen FLEXR. If you want to look that up and maybe print out the page and take it to them. Any tips to cope with sensory symptoms like glove and stocking symptoms? I've had some success with that, and in other cases I've not. There have been some where I've felt like for days I had like water dripping down my leg, or ants crawling up my foot. The TENS unit that I mentioned earlier that may help with spasticity or pain has been effective for me at some times with that. Other times, no. The glove and stocking symptoms, what you're describing is also very akin to the MS hug. It can be around a limb. It's often around the chest. I found that cooling helps a lot with that compression sort of symptom. It just relaxes it when I cool from the inside as well as from the outside. So I may drink a tall glass of very, very cold liquid and put on a cooling vest and cooling scarf, and it just relaxes. It can have been in place for a day, and all of a sudden a light goes on and I say, oh, cool, and it helps. Cognition Help, we just covered that. Cognition Help, you really need to mention to your doctor that you're having some cognition issues, and get some basic neuropsychological testing done, and then they will tailor your help to what you're doing. Recommendations for managing symptoms during the hotter months, and where can I find this recording saved? You're going to see the live recording on Facebook for the next few days, but we do have a YouTube channel, the Multiple Sclerosis Foundation or MS Focus YouTube channel archives all of these. So if you just go into YouTube, look for Multiple Sclerosis Foundation, and then type in symptom management, and you should see this webinar pop up. Sometimes they're pretty quick going up, other times they can take a week or two, so just be patient with us. What spasticity means. She's heard the term a lot, but let's see, heard the term a lot, but not sure what it is and what the symptoms are. Again, that's something that we covered earlier. Spasticity, there are two types of spasticity. There's what's called a tonic spasticity, meaning that things get tight. There's a clonic, meaning that it's jerking. So I find that my spasticity tends to be tonic. It's more, I don't have a jerking kind of spasticity. It's like my muscles start to tighten and they stay tight, and that can cause a pull on if my arm is in spasm, it causes a pull on my shoulder muscles and causes some shoulder pain. My legs in spasm or my low back's in spasm, it causes a pull on the hip sockets, the hip joints. And so I end up with pain there. You can often notice that one side will be tighter than the other. And for those of you that have spasticity in your leg, you may feel your quad, the top of your thigh may be softer on one side than the other. The side that's not as soft is probably in a little bit of a spasm. Let's see, suggestions for itching. Itching occurs with me that is not allergy or insect bite related. Yeah, there is, itching is another symptom that can be very, very common with people who have MS. Oftentimes, again, the things that I mentioned, like a lidocaine cream or EMLA cream over the area will help. Generally, things like Benadryl cream or cortisone cream don't help with the MS itching. Sometimes a Benadryl will help, but not always. And in the worst case scenario, you may need to go to a medication that, usually a medication that comes from the epilepsy arena that will help to temper that nerve reaction. My physical therapist also used cupping for my sore muscles. What are your thoughts on that? I thought it worked well for me. I'd say anything that works well, go for it. Cupping is a technique that's often used by physical therapists and massage therapists. They have to have special training in how to do that particular technique. But just next time you're with your physical therapist, ask them if what you're presenting with would respond to cupping, and ask them to explain it to you, ask them to try it on you if they think that it might be something that would be helpful. Okay, the queue is empty. Anybody else?
Cherie, could you just talk a little bit, considering the season and the epic heat that people are experiencing, a little bit more about cooling strategies, pre-cooling, recovery cooling, etc.?
Yeah. What we're finding is with exercise programs, particularly in this kind of heat, people tend to be able to exercise longer and at a higher intensity if they cool first. So putting on a cooling vest and scarves, maybe even wrist or ankle wraps, putting an ice pack under a cap, things like that, just getting yourself cool for 15 to 20 minutes before starting your exercise. You should be able to exercise longer and more effectively. I find that when I get overheated, which for me is anything much over 70, or humidity even lower than that if the humidity is really high. Now today here outdoors, it is 91 degrees with 97% humidity. So there's no way I can be out in this kind of thing. We have an old house, as you can probably tell from the backdrop, 1800s. And there's no ductwork in here to put air conditioning in. So I've got a window air conditioner unit in 2 windows in the house. If you need a window air conditioner unit for your apartment or your bedroom and you're not able to afford it, reach out to us at msfocus.org and we can see if there are monies available to help get an air conditioner for you. Also, if you have a Habitat for Humanity restore in your area, they're a resale shop for the Habitat for Humanity chapters, and they're used to raise money to support their building programs. Many people will often, if they upgrade their homes, they will donate. If they put in central air, they'll donate their window units, and that's actually how we got ours at $25 a piece. So those are options for doing that. I always keep an extra set of inserts for my cooling vests frozen, because I've got a room in my house that has no way I could put an air conditioner in the room, and it's a room that during much of the year I spend a lot of time in working. And so I actually will wear my cooling vest and scarf in that room while I'm working. It's what keeps me more productive. So our cooling program with the MS Foundation actually closes on June 1st every year, but it's open February 1st to June 1st every year. The National MS Society and the MS Association of America also have some cooling products available at times other than when we offer them to our readers, our viewers. So there's always an option out there. There are a couple of companies that I know have very good cooling products. If you want to just go online and purchase them from them, Polar Products is a wonderful family-owned business here in the United States, and they donate an awful lot to the MS Foundation, to MS Focus. Many of my cooling supplies over the years have come from them. I like their products for looks. They're not quite as long lasting with the cooling because the cooling packs are a little bit smaller than those of Steel Vest. That's Steel with an E on the end. Steel Vest we also give out during our cooling program. Those packs are much larger, and I find that they keep me cool for probably 3 hours, where the packs in the Polar Products vests maybe an hour, hour and a half. So you know, just keep a spare set if you can in the freezer so that you can replace them as needed. Drinking lots of cold beverages, making slushies, put them in the blender with ice cubes. Okay, Linda has just put in the question and answer. Foot Flexor can be found at www.ontrackandfield.com, and they're $39.50. Thoughts on using symptoms tracking to find specific diet triggers? I'm working with a health and nutrition coach to help me with that. I think you're right exactly where you need to be with a health and nutrition coach. I can give you general things that if you're not ticking into anything definite that seems to be triggering your symptoms, try eliminating a category of food for a 4-week period. Like you can take glutens out of your diet, which is your breads, your pastas, using only gluten-free substitutes for them, and And then if you don't notice any real difference, add it back in. You should notice if it's a trigger once you add it back in. The same thing with dairy or sugar or soy or corn or any number of things that we might be sensitive to. Any idea how to find a neurologist who has more experience with elderly patients with MS? Our focus differs in what we don't look for active treatment for the MS itself, but more to differentiate what's a side effect from years of therapy as opposed to normal aging. I hear you. My first hospitalization was at the age of 23, and I will be 70 next month. So I totally understand. We have done several webinars over the last 3 or 4 years on the difference of aging and MS symptoms. And I'm sorry that you're not looking for ways to manage your MS. We really, even into our 70s and 80s, we need to be managing our MS, not just ignoring it, because MS is there. It's impacting us. And I really think that we're selling ourselves short when we say we're old enough, we don't need to manage the MS. MS impacts all the same things that aging does. We just never knew until the last 15 or 20 years how to age with MS, because people didn't live old enough to age out for the most part. We tended to succumb to side effects of infections that were caused by not keeping our MS managed, not keeping it under control. Once, however, we got to the point where we had effective disease-modifying therapies from the mid-1990s on, we started seeing people with MS living longer and longer and longer, and more healthy and active. So if you're not on a disease-modifying therapy, that still may be a question you need to have with your doctor. Let's see. I think we're at the top of the hour.
We are indeed.
Casey, do you have parting words?
Just to say thank you, Cherie, for so much great information. Thank you to all of our audience for being here, for your attendance and your participation. We do ask, you will have a survey pop up when you leave the program today. And we ask that, if at all possible, you take a few minutes to give us your feedback on the program so that we can continue to tailor programs like these to your needs. It also, this feedback helps us to be able to get the funding to do programs like this and our other educational programs throughout the year. So we really appreciate when you take the time. It's just 2 or 3 minutes to do that little survey. Our next program will be Thursday of next week. That's July 28th at 6 p.m. And the topic is Hope for Progressive MS. And that's with Daniel Cantor. We hope that you'll be able to join us for that program as well. If you have questions about how to register or about how to find the recording of today's program, please reply to your registration email and we'll be happy to get that information out to you. So again, thank you all for being here. And Cherie, thank you so much for the great information and for your openness in sharing your experiences with MS. Thank you.
Thank you.